So for kids who are having difficulty breathing, and you're thinking about what the surgical options are, the first thing to try to find out is why they are having that problem, because the hope is that you can fix that problem or help them in some way. So if you can, that is the hard part for parents is when it gets to surgery, explaining the risk to a parent that your child who is having a breathing problem, you are then going to put them under anesthesia and put them more at risk in order to be able to find a solution. So often with those kids, we talk about if we can find a fix, we will fix. But if we can't, we have to talk about either intubating them, which means putting a breathing tube down their mouth or their nose and putting them on a ventilator to breathe, or putting a trach in their neck, which is a small plastic tube that sits below their vocal cords and above their and in their airway to allow them to bypass whatever problem they have to give us time to figure a solution.
And then there are other alternatives that aren't surgical.
It depends what the problem is. If for children who have sleep apnea, who have neuromuscular problems, who have weaknesses, who have had a host of other issues, sometimes they can use masks, and they're called CPAP masks or BiPAP masks or positive pressure masks or nasal cannulas in the nose. There's a host of ways of trying to supplement or give. The goal is to get oxygen to your brain. So how could we do that? They're making the decision. So many of those parents, it's like whatever reason that is, they're going to see something in their child's neck, and it's going to transform them, their family. If there are siblings in the house, they imagine the siblings pulling this thing out. How are they going to care for this? Or is the child going to die on their watch while they have this artificial airway? What the initial shock is, whatever life they had yesterday is not the life they're going to have tomorrow, and that's why it's so hard. There's a variety of genetic syndromes and neuromuscular syndromes where it's really important to think about what is your child's quality of life, and would a trach prolong something, a life that otherwise there may or may not be suffering with, and you may or may not feel it's worthwhile. And then the one thing that I have learned is that there is no right answer to that one. But that is for kids who, for instance, who have SMA syndrome would be one. Kids who have bad muscular myopathies is another. Where we say, should we have a child on CPAP? Should we have a child? Should they stop breathing, or would a trach prolong their lives in a way that the parents may or may not understand? There's a difference between stopping breathing and working to breathe and watching your child suffer to try to draw a breath. And I think that if you could almost draw two distinct populations. That if you didn't put a trach in, that child would quietly stop breathing and go. That's one thing. To see your child, we have seen it and lived it. To see your child, a parent watch their child struggle to breathe is one of the most horrific things, and that's not one that most people can watch for too long.